How to know it's not a hammer, mallet or claw toe is really important. We've got a few differentials or differential diagnoses on the board here, and really going through these and making sure that it's not just one of these or it could be in combination is really important. So when we look at plantar plate pathology, doing that dorsal draw where we're bringing the second, third or fourth toe, more dorsally, stretching that plantar plate is going to be positive if there is concerns there. Again, we can palpate directly onto that plantar plate and really get a good idea of what's happening. Very often I'll check the medial and the lateral aspects to ensure that, okay, is it just a partial tear? Because, if it's medial, the toe's going to drift lateral and vice versa. And so we really want to get a greater understanding of what we're looking at. It could just be that it's, an attenuation or stretching of the plantar plate that's chronically degenerative rather than scarring. There could be some osteoarthritis or inflammatory arthritis associated. So really being aware of, okay, is it rigid? If it is rigid, is that potentially osteoarthritis or rheumatoid or psoriatic in nature? And getting a really good history so that we can guide appropriate treatment and, diagnosis that way as well. There's quite often patients that come through to me and say, I've just got a corn, what we typically call a Heloma durum or a Heloma molle, being a hard corn or a soft corn. But these are areas of, denser callus or hyperkeratosis to the toes that may develop into wounds if they're untreated. And these cause a lot of pain. It can be just these, but typically I see that it's, corns due to underlying osteophytes, and x-rays are the best way to sort of get a better idea of whether this is the case. When this is the case, there's really simple ways that we can fix this, non-surgically as well as surgically, but getting that initial diagnosis is really important. Hammertoes will put you at a greater risk of having these corns and the concerns around it. One of our other conditions, Freiberg's disease or avascular necrosis of the typically second metatarsal head, but sometimes the third metatarsal head, can be of concern as well. And that's basically where we've got an overloading of that metatarsophalangeal joint, or in particular the head of the metatarsal. Typically to the second, we're going to see this during that, sort of mid to late stage on x-rays quite clearly, but MRI will come up quite often, and typically this is predisposed due to either a longer second metatarsal, or it could potentially be that it's a little bit more plantar flexed and therefore taking a bit of load. So there's some really simple things that are causing the concerns here, and simple things that we can potentially treat this with. And so we just need to be really aware, okay, is this the diagnosis or is there more happening? And a lot of the time you can be very clear with your hammer, claw and mallet toe diagnosis. We just want to make sure that one of these differentials is not there either. So hopefully you've got a bit of information out of this video. If you've liked this, please hit the subscribe button. Otherwise, we'll see you on some of our other videos and we'll talk to you soon. Cheers.